How's it going, guys? Past level question for Obgyn Repro for 2CK for studying for step 1. This stuff is known to show up on the exam, but could be considered medium to more difficult, okay? But Obgyn, no fucking excuses. You need to know this. Before we get started, please subscribe to the channel. I really appreciate it. Give it a like. Really appreciate it. Find me on Instagram, threads, Mehlmanmedical, Mehlman_medical, links down below from your Telegram, links to the Telegram group or channel down below to start the clip. 24-year-old woman, 40 weeks gestation, and she has fetal heart rate monitoring during parturition. Means giving birth. Let's learn some vocabulary, okay? And then we simply have, I didn't label this on purpose because you're supposed to know, and the USMLE will give you a very Windows 98 type bootleg image in black and white, and they just expect you to know what the curves are referring to, okay? So this top curve is the fetal heart rate. Normally it should be 110 to 160, and you can see it appears to have dipped down here. And then on the bottom, we've got the uterine contraction. You can see that there's a contraction occurring here with the crest. You don't have to worry about units or anything like that. Yes, for 2CK, for shelves especially, there can be Monto video units. Talk about a bunch of nonsense I don't want to get into right now. But looking at these curves, what you need to know for starters is what an acceleration is, okay? Like you're literally hitting the gas, an acceleration. So an acceleration is reflective of normal fetal well-being, which means that when we do fetal heart rate tracing, we are going to see about every 20 minutes or so, there will be a spike in fetal heart rate, an increase about 20 beats per minute. It lasts about 20 seconds and then it falls back down, okay? And that will occur 2 to 3 times every 20 minutes. We just call those accelerations, okay? And those are just reflective of fetal well-being. Now, holy shit, we have something called decelerations where we get a dip in the fetal heart rate. And USMLE wants you to know what these are. So let's just whip through the answer choice here. Choice A, fetal cord compression, wrong fucking answer. Now, fetal cord compression equals variable decelerations on USMLE, which will mean that if they show you a fetal heart rate tracing such as this, you will see no relationship between the uterine contraction, this bottom curve, and the fetal heart rate, the top curve. In other words, they'll just show you they'll show you 3 or 4 uterine contractions, and then they'll show you 1 or 2, maybe 3 decelerations, dips in the heart rate, and there's no relationship that you can see that's conspicuous. Those are variable decelerations. Those reflect fetal umbilical cord compression. It literally just ends there. Wrong fucking answer. Choice B, fetal head compression, correct answer. This is showing us what's called an early deceleration. Now you can see that the uterine contraction and the fetal heart rate dip in the same y-axis. They're in the same vertical axis. They occur at the same time. This is called an early decel and just simply equals fetal head compression USMLE. They want you to know that this is due to vagal outflow. Okay, you get a transient increase in vascular resistance due to the compression, and that's going to cause vagal outflow. They asked that on one of the OBGYN forms, even though that sounds very step 1 mechanistic. Okay, so not only do you need to know the graphs here, but you need to know that mechanism. So this is an early deceleration. Let's just continue whipping to the other answer choice here. I'm going to do choice E next. Uteroplacental insufficiency, wrong fucking answer. This equals fetal hypoxia, just insufficient blood flow to the fetus, and will present as a late deceleration, which is when we have a uterine contraction, and then the dip in the fetal heart rate occurs slightly after. It's slightly delayed / protracted in comparison to the uterine contraction. Okay, so they're not in the same y-axis. There'll be a slight, if we were to connect the zenith of the crest of the uterine contraction to the nadir, the dip in the fetal heart rate, we would have a positively sloped line. Okay, they're not in the same y-axis. So that's a late deceleration. You need to know that for variable decelerations, they want amnio infusion on USMLE. I've seen that as an answer on one of the forms. So for both variable and late decelerations, you will stop all oxytocin if the female is on it. You position her left lateral decubitus and you give oxygen. Fetal head compression, I haven't seen them assess that. Now, real quick, fetal sleep state and maternal fever, both wrong fucking answers clearly. Now, these are going to present as straight lines in the fetal heart rate, okay? So straight lines, there's no acceleration, no deceleration, and this is the distinction. Fetal sleep state, you're going to have a normal heart rate between 110 and 160. So they just give you EG, fetal heart rate of 140, and it's a straight line. And you're like, well, I don't really know what's going on. It's just fetal sleep state. It's an answer on one of the forms. Now, maternal fever, they're going to give you a straight line in the fetal heart rate, but it will be fetal tachycardia. That's what they do. So they give you a fetal heart rate, it's 180, and you see that it's a straight line. And the answer is just maternal fever on USMLE. Wrong fucking answer. You know the deal. I'm just going to make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.